Hi guys, Dr. Sadaf, and today I was able to see a patient that I had seen initially back in December. And when I first saw her, so she's a 58-year-old postmenopausal woman, and when I initially had seen her, when I did her exam, she was having, a lot of pain in her vulva. She had been having it for years and had seen a previous gynecologist that only had like about 10 minutes to see her in the office and wasn't really able to treat what was causing her the pain. So I noticed that she had something called lichen sclerosis, and if you haven't listened to my podcast on lichen sclerosis, I really want you to go look up the Muslim Sex podcast and find the episode on lichen sclerosis, and you can learn more about it, but you can also find out the treatment on it. So she had lichen sclerosis. She also had vestibulodynia, which is pain in the vestibule, and she had vaginal dryness from menopause. She also had vaginismus. So she had a whole bunch of stuff going on, right? And one thing led to another, meaning like because she had lichen sclerosis, she was having pain, right, with intercourse. And then add on top of that, she had vestibulodynia, so she had pain in the vestibule, which was also adding to the pain with intercourse. She developed secondary vaginismus, meaning it's where the muscles surrounding the vagina tighten up in anticipation of any type of pain. So because she had these two other prior conditions causing her pain, the muscles in her vagina started to tighten up also, and so that was also causing her pain. So she had a lot of stuff going on. And then she had a partner that was experiencing erectile dysfunction because he didn't want to, he was so worried about causing her pain every time they had intercourse that he had issues with erection, and then also he wasn't able to orgasm. When I started to ask her a little bit more about her partner, she told me that he was on antidepressants. So we know one of the side effects for antidepressants is anorgasmia, like patients have a hard time achieving orgasm. And one of the other side effects can also be erectile dysfunction. So, when I told her that, she was really surprised. She had no idea. And his primary care doctor had never talked about the sexual side effects of antidepressants with him. And so when I mentioned it to her, she told her husband, and he mentioned it to his primary, and they actually ended up discontinuing his antidepressants. And now he was able to, about a week later, he was able to achieve an erection and also was able to orgasm. Now going back to her, she had lichen sclerosis, she had vestibulodynia, and so I started treating her for the medications that are needed for lichen sclerosis and for vestibulodynia, and she started to get better. She also started going to a pelvic floor therapist for her vaginismus, and that started to get better. And because she was also using vaginal estrogen, her vaginal dryness was getting better. So we were, treating the whole problem, not just one thing. And once we started treating the whole problem and she was feeling better, she was able to be intimate with her partner, who was also starting to feel better because he was off of these antidepressants. And now they are really enjoying their intimate life again.